even under the weather. You just make me feel sweet.
I'm New York State Assemblywoman Monique Chandler Waterman here to say, what's up? We are here for New York City Daniels Day as part of a state coalition. Daniel Prude was unfortunately killed while having a mental health crisis at the hands of law enforcement. We don't believe that law enforcement should be responding to those in mental health crisis. So today we are here to do a wellness event on Daniel's birthday, and we also are celebrating Shahid Vassell, Erd Pierre, and others who have lost their lives while having a mental health crisis. We want to bring healing, restoration, but also what services can you get for yourself or your loved ones or your family. We have 988 Mental Health Crisis Hotline. If you know somebody or you need some support, you can call 988, you can text, call, or you can chat with 988, a mental health professional. Please come and make sure you come to the event, but also make sure you take advantage of that number. Thank you so much.
Hello, my name is India. We're here representing BTTM, Brownsville Think Tank Matters, and
Drum.
So we're here today because it's Daniels Day. It was a youth that was killed by police for a mental health issue. So we're just here giving support. We're giving resources. We're with the crisis management system, Cure Violence. So we're just here supporting the family. What we do is try to de-escalate situations before it gets too far with police officers. So if we happen to be canvassing in the area and we see someone with a mental health or a crisis happening, we try to de-escalate it as much as we can, just so that situations like this don't occur where somebody is shot and killed.
Mental health is a serious issue and it needs to be dealt with on a different level. You can't deal with it on one level. It have to be different levels so that the person that's have the mental issue will be receptive to the information that the person is dealing with, so that that person can calm down and the issue wouldn't get blown up to where the individual got shot. That was a tragedy for the young man to get shot. He was playing with some metal and they proceeded it as a gun, and they did not talk to him. He got killed. Excuse me, they unalived him. If you had somebody or they would have had previous training about mental health, that situation wouldn't exist.
Oftentimes we call 911 for every emergency. If there's a fire, we call 911. You're going to get the police still, but fire department is going to show up because they're the professionals in that respective space. You have a health issue, physical health issue, you're going to call 911, you're going to get an EMT or an ambulance to come to service you on the health side of it to get you to another health professional. When it comes to mental health, we don't really have, or we didn't have, somewhere to call or someone to respond to it. The police should not be responding to mental health, someone suffering a mental health crisis. Again, when you call those for any of those other emergencies, you get an appropriate response. So we want to have that appropriate response for those suffering mental health crisis. We now have 988, which our organization has helped to push statewide to ensure that when you call 988, you get not only a mental health professional on the phone, but you get a response that's conducive to the dynamic of what is taking place for that individual or individuals suffering a mental health crisis in real time.
My name is Richard Bonner. I'm representing Drum, BTTM. We're representing here for Assemblywoman Waterman, to represent her for Daniels Day. Many people, upon my youth growing up, we didn't know the education, or should I say we have the information on what mental health was always about. We're better informed now and what it is that we could do with them and for them. And I'm definitely glad that, we are now more educated in that area. Of course, working within the community, we come across many individuals who may be victims of mental health, So again, we look to assist them as well as anyone else, provide them with information, brochures and information and directions of where they could go, and also just be there to assist them if they need it.
Hi, I'm Councilmember Rita Joseph. I represent the 40th Council District. I'm here today for Daniels Day because mental health is so important. We saw post-pandemic what our young people were going through. That's why in the council, Councilmember Eric Botcher and myself, we made sure that 988 are available in all New York City public schools to make sure that we're supporting our students and make sure that school-based clinics also provide mental health support. We also have mental health continuum in central Brooklyn in schools, so we know how important mental health is, and that's why I'm here today to support.
My name is Shaka Fair. I am a clinical social worker, and I came here on behalf of Monique, Assembly member Monique Chandler Waterman. I am a member of her mental health task force, and today is Daniel's Day. Today is a day where we've had so many families that have contacted 911 as a result of a mental health emergency, and instead of getting assistance, their family members were killed by the police. Police don't have the proper training to deal with people who are having mental health emergencies and are used to dealing with them with the one tool that they have, which is force and the law. This is part of the process, as we want to make everyone aware that there are ways for you to deal with mental health emergencies, and then when a person contacts that number, then they can find out what resources that would be available to them. They may be able to de-escalate the situation and stop it from getting to a place where people end up being murdered.
Hi, my name is Emily. I am here with NAMI, the National Alliance on Mental Illness. We are here today, of course, in support of the 4th annual Daniel's Day. We support Peers Not Police. As an organization, we provide support and resources for those living with mental illness or for those who have peers or family members who are living with mental illness. So we have plenty of support groups and activities and events for anyone who has those needs, and as this type of organization does represent that, we absolutely represent and stand for Peers Not Police, which is the whole affair for today. So we are very happy to be here in support of Daniel's Day. You can absolutely call our helpline, which is not necessarily like straight up help. It's also just an information line, and you can call our phone number, which is 212-684-3264. Tuesday, September 30th, we have a tech, social media, and youth mental health virtual town hall. So we will have different speakers, panelists with a Q&A talking about social media and its effects on teens and how to best help cope with anything that would come with that in a negative light, and how to help teens get through that in a healthy way.
Hey, my name is Sheena Burnett. I am the Managing Director of Advocacy for Justice for Erd Pierre. Justice for Erd represents my cousin Erd Pierre, who was killed while he was in a mental health crisis, December 20th, 2021 on Eastern Parkway in Utica, but also represents everyone who's still living who is in need of care and who should not be met with police while they're in moments of crisis, but with people who care, who can meet them in compassion and make sure that they keep living and thriving and reach a life in recovery. He called 911. The police showed up. He had a small pink kitchen knife, so they tased him a few times, asked him to put the knife down. He eventually exited the subway station. He started running, and they said they were in fear of his life because it seemed like he was running towards them. So they fired 10 shots at him, killing him. But as a family, we after seeing the body cam footage, we believe he was running away in fear because the officers didn't show up with care. They were aggressive. They escalated the situation. They tased him. They were not there to help him. Well, of course, the family's heartbroken, but we put everything into keeping Erd's legacy alive by advocating and talking to elected officials, going to Albany and City Hall, and just hoping that they hear us and they understand that we need more mental health awareness. We need to break the stigma, and we need to make sure that we're not meeting people in crisis. We want to make sure that people in crisis are not being met with a public safety response, but a public health response. We also have Eastern Parkway in Utica, codenamed to Erd Pierre Way, which is another way that we believe will keep his name and his legacy going. You can follow us on Justice for Erd on Instagram, that's EUDES, or you could email us at justiceforerd.com.
Good afternoon, everyone. My name is Ruth Lowenkron. I'm the director of the Disability Justice Program at New York Lawyers for the Public Interest, and this is...
I'm Megan Johannesson. I'm an Equal Justice Works Fellow sponsored by Morgan Stanley and Davis Polk at New York Lawyers for the Public Interest. I'm advocating for people with developmental disabilities to have better access to services from the state and to understand the services that they have access to and what they don't have access to so that they can appeal those terminations.
And we're here today to let people know about the services we offer to people with disabilities. We involve ourselves in advocacy on a systemic basis. So we do large impact litigation cases. We try and get legislation passed. We are in the streets having demonstrations. And the areas that are very much priorities for us that bring us here today on Daniel's Day is our work on Daniel's Law. That's state legislation to change the way we respond to mental health crises in New York. Instead of having police respond, we want trained peers, individuals with lived mental health experience, and trained emergency medical technicians. We want it treated like a health condition, not a criminal matter that needs police. When I first started in this work 9 years ago, I thought the answer, and along with others in the community, we thought the answer was to train cops to do a better job. We knew that cops had already killed far too many people. One person is too many people, but they had already killed far more than that in the city alone. And so we thought, well, they just need to be trained. But we realized training wasn't enough, and bringing police into a crisis is criminalizing the mental health issue. It's a health issue, not a criminal matter, and it requires treatment like a health matter. And that's how we can avoid not only the horrific deaths, which in New York City alone, 21 individuals shot and killed at the hands of the police when experiencing a mental health crisis in the last 9 years. More before that, more who were seriously injured, more who were brought to psychiatric hospitals against their will when that was not necessary, more involved in the police and the criminal legal system that shouldn't have been involved. All of that can be done away with by removing the police altogether in the vast majority of circumstances when an individual experiences a mental health or a substance use crisis. Anyone who has issues around disability, please, they can feel free to call us at 212-244-4664, or they can visit our website at www.NYLPI, New York Lawyers Public Interest.org. I want to say what's up to the entire mental health community and the broader disability justice community, because we need to band together, work together, and advocate for success for the community.
What's up, New York? I am Queen Expressions, the inspirational DJ. I am literally passing through. The spirit led me to come through this block on Montgomery, and I passed through the Mental Health Awareness Day. And when I tell you the energy is so beautiful, the frequency is so high, and it's about love, peace, and unity. Self-love is the best love. You can't give no one else love until you give yourself love. So I'm passing through, and the universe blessed me with this frequency. Shout out to What's Up, New York. I am so thankful for y'all and the organizations. Thank you so much. The whole notion of mental health is really, really relevant, and not just our communities, but in the world. And it's very important to not just be able to just call 911 or call a friend, but there's a hotline number you could call to get the proper help that you need and guidance that you need. So I literally co-sign this. Queen Expression, the inspirational DJ, we are here. What's up, New York? Let's go. I want to say what's up to What's Up, New York, first and foremost. I want to say what's up to BK Halal, because I am their official DJ as well. I want to say what's up to Ujama. I am their official DJ as well. Shout out to Twin Sound, and so more and so forth. But I want to give a big shout out to the woman that raised me and made me, Regina Cook. Thank you so much, and shout out to my father.
My name is Curtis Williams. I'm part of One Brooklyn Health. And One Brooklyn Health is basically a combination of 3 different hospitals, which is Kingsbrook, Brookdale, and Interfaith. Like you said, we got a lot of things happening at Brookdale Hospital. We're in the process of building a brand new emergency room right now. Recently opened a brand new 2 brand new mental health areas. And we also have a pretty brand new ICU area as well. So we're trying to make improvements for the community. Brookdale Hospital in particular covers Brownsville, East New York, Canarsie, and East Flatbush. So, you know, we cover a large area, and we're the only trauma center over there. I want to say what's up to One Brooklyn Health. Shout out to Brookdale, shout out to Interfaith, shout out to Kingsbrook, shout out to Brooklyn.
Hello, my name is Cheryl John. I'm the Brooklyn political organizer. The reason we are here is we are here for Daniel's Day. This was a young man that suffered from mental illness who was shot by a cop. And we are here to bring awareness on mental health issues. And 1199 is just here serving the community and bringing awareness into the community.
Mental health is real, and people need assistance, not going to jail. They just need somebody to assist them, and we need to have more people who are more educated in mental health to do the right thing.
My name is attorney Roland Otley from the Otley Law Firm. I'm out here to just interact with my community members and to see how I could contribute to helping them with immigration matters. For those people who have mental health, there are many nonprofit organizations and city organizations who can provide them with the help that they need. It's a very challenging situation because of the mental illness, and some of the people that need this help may not be in a situation that they could comply with what they need to comply with to actually get the help. So that would make it an even more difficult and challenging situation. So family members and friends may also need to be involved to provide them with the necessary support and to encourage them to comply so that they can receive the necessary benefits that they're seeking and they need.
My name is Susan Shervington. I'm a Vocal New York advocate for civil rights, as well as Daniel's Law Coalition Committee. I've been doing Daniel's Law since the beginning, and I came out today to tell my story. My son was almost killed by the police before there was 988, so we have to do better. We need to take the police out of the mental health crisis. The police should not be involved at all in mental health crisis because they kill people. I'm also on the Win Rosario committee at Justice Committee, and it's terrible. He was 19 years old, and within seconds he was murdered. My son, before 988, I called 911. They came in, they almost killed my son. The only reason he's alive is because my daughter ran out of the room and jumped in front of him. They had 6 guns drawn for my son, and he needed mental health. He didn't need the police to shoot and kill him. They're not trained to help people with mental illness. If you have a headache, you don't call the police. You know what I'm saying? So that's why I'm here. When you have a headache, you don't call the police. You call paramedics, an ambulance. So when you have a mental health crisis, the police should not show up. They are not trained, and we have people, peers. We have EMTs, which all have proven that they can help the people in a crisis. Police don't want to do the job. If you ask them, they don't want to be trained and they don't want to do the job at all. And they should not be forced to do something that they are not called to do. They are taught to shoot and kill, which is what they do 80% of the time.
My name is Rashia Brown. I'm a licensed esthetician. I'm located in Brooklyn. We out here, we're just advertising our products and our services, as I do a variety of services and I have a variety of products. One of the products that we're advertising today is called Super Patch, and how the patch works is basically by neuroscience, simply by the touch. You can reach me on my cell phone number, which is 718-813-9207. You could also reach me on Facebook. Rashia Brown is a blue and white shirt in the picture. And then you can also reach me on Instagram at Snatched and Enhanced by Shia and Us.